Which blood pressure number is more dangerous? Systolic versus diastolic. When a medical professional measures your blood pressure and the reading comes back as 148/78, it's very common to focus on that second lower number. Many individuals instinctively think, the bottom number seems fine, so everything must be okay. This perception is widespread, with many patients holding on to that diastolic number as if it were a clear sign of safety. However, after many years dedicated to understanding the cardiovascular system, it has become clear that this way of thinking, particularly for individuals over the age of 60, can lead to serious health complications that might otherwise be prevented. The number that truly holds the most significance for those in their later years is often not the one people tend to watch. This discussion aims to clarify precisely which number deserves your attention, explain why your arteries operate under entirely different principles after the age of 60, and outline concrete steps you can take starting today to safeguard your health without waiting for a significant health crisis to emerge. This information is profoundly important for your long-term well-being. Blood pressure management after the age of 60 becomes an entirely different conversation compared to earlier life stages. Most individuals first learn about blood pressure in their 40s, perhaps receiving advice to reduce salt intake, after which life largely continues as before. Yet, the way your cardiovascular system responds to and handles pressure undergoes significant and dramatic changes as you grow older. What might have been considered manageable or low risk at 45 can become genuinely dangerous and life-threatening at 65, even with the same numerical readings, the same blood pressure numbers signify different risks depending on the body's age and its unique physiological changes. What was once harmless can, with age, become a silent and profound danger. It's essential to understand the correct terminology and what these numbers truly represent. When a healthcare provider takes your blood pressure, you are provided with two distinct numbers, for instance, a reading of 148/78. Let's explore what each of these figures indicates. The first number, 148, represents your systolic pressure. This is the force generated by your heart when it contracts powerfully to squeeze and propel blood out into your arteries, circulating it throughout your body. You can visualize this as the peak pressure within your system, the moment when your heart exerts its maximum effort. The second number, 78, is your diastolic pressure. This measurement reflects the pressure within your arteries when your heart is in its resting phase, specifically between beats when it is refilling with blood. For many decades, the medical community placed a substantial emphasis on that bottom number, the diastolic pressure. Diastolic hypertension, or high diastolic pressure, was traditionally considered the primary cardiovascular threat, and for younger adults, it certainly remains a valid and critical concern. However, a fundamental shift occurs in the cardiovascular system after the age of 60. The intricate relationship between these two numbers, systolic and diastolic, undergoes a profound transformation, and consequently, the specific risks that can lead to serious illness or even be fatal also evolve. The core understanding that needs to be grasped is this: once you reach 60, your arteries are no longer the same flexible, pliable tubes they were in your 30s. They have naturally stiffened over time, and this singular biological fact fundamentally alters which blood pressure number truly merits your vigilant attention and, frankly, the focused concern of your healthcare team. This phenomenon is often referred to as the stiff pipe problem. Consider a flexible hose, perhaps one used for gardening when it is new and supple in the spring. It is soft, easily maneuverable, and readily bounces back when gently squeezed, offering virtually no resistance to the flow of water. Now, envision that very same hose after it has been exposed to the elements, left outdoors through 10 harsh winters. It would likely become rigid, brittle, and if you tried to bend it, it might easily crack or break. This analogy closely parallels what happens to your arteries over the course of many years. This stiffening is not necessarily an indication that something has gone wrong. Rather, it is a natural and inevitable biological process of aging. Gradually, the elastic tissue within the artery walls is replaced by collagen fibers. causing the walls to thicken and lose their inherent ability to expand and contract flexibly. In a healthy, younger cardiovascular system, when your heart contracts and forcefully pushes blood out, the compliant arteries act much like shock absorbers. They gently expand to accommodate the surge of blood, then gracefully spring back into shape. This ensures that the peak force of the blood flow remains controlled and modulated. However, stiffened arteries cannot perform this crucial function. When the heart contracts and propels blood forward, there is significantly less room for that pressure to dissipate or be absorbed. The pressure wave hits these rigid arterial walls and is forced back with considerable intensity, causing your systolic blood pressure number to spike dramatically. Simultaneously, the diastolic pressure, the lower number, might remain stable or even show a slight decrease. This disparity is precisely where a dangerous misunderstanding often arises for many individuals. This biological change explains why so many people over the age of 60 frequently present with a significantly elevated top blood pressure number, while their bottom number appears perfectly normal. Far from being a reassuring sign, this specific pattern is, in fact, a critical warning. It is a recognized medical condition known as isolated systolic hypertension, ISH. This occurs when your systolic number consistently registers at or above 140, while your diastolic number remains comfortably below 90. The troubling aspect is that patients exhibiting this normal bottom-high-top pattern often report feeling entirely well. They experience no headaches, no episodes of dizziness, and no other dramatic overt warning symptoms. Consequently, they tend to dismiss these readings, believing that if their diastolic pressure is normal, they must be in good health. This complacency is precisely where the danger lies, and it is a conversation that healthcare providers encounter with concerning frequency. The scientific research on this topic is remarkably clear and unambiguous. Isolated systolic hypertension is not merely an innocuous characteristic of aging. It is not a condition to be simply accepted or disregarded. On the contrary, it stands as one of the most potent and consistent predictors of future cardiovascular events such as heart attack, stroke, and heart failure, specifically in adults over the age of 60. In this particular age demographic, it is considered a stronger indicator of risk than an elevated diastolic pressure alone. A seminal study in cardiovascular medicine demonstrated that for every 10-point increment in systolic pressure above the 140 mm threshold, the overall cardiovascular risk increased by approximately 20%. Consider the implications of a 20% increased risk for just a 10-point rise in systolic pressure. Picture an individual whose systolic pressure consistently hovers around 160 mmHg, yet they feel a sense of relief because their diastolic reading is a perfectly normal 75 mmHg. That seemingly harmless gap between the high systolic and normal diastolic numbers is, in reality, silently carrying a substantial, life-shortening risk. It prompts a vital question for self-reflection. When was the last time you accurately checked your top blood pressure number at home, rather than relying solely on sporadic measurements taken during a doctor's visit? Understanding these numbers is crucial for proactive health management. After many years spent in operating rooms, witnessing and managing the severe consequences of inadequately controlled blood pressure, the preference of medical professionals is always to engage in preventative discussions now, rather than meeting under far more dire circumstances later. There is a critical aspect of blood pressure management that often does not receive sufficient attention during routine medical checkups: the profound sensitivity of your brain to pressure fluctuations. Your brain, an incredibly intricate organ, relies on a constant, meticulously regulated blood supply. Billions of neurons are sustained around the clock by an extensive network of tiny blood vessels, some of which are finer than a human hair. These delicate microvessels are frequently among the first structures to suffer damage from chronic high systolic pressure. Each surge of blood, every single heartbeat when the systolic pressure reaches 150 or 160 mmHg, delivers a small, repetitive mechanical shock to these sensitive brain vessels. While an occasional surge might be manageable, the cumulative effect becomes devastating when this occurs tens of thousands of times a day for months and even years. Over time, these delicate vessels begin to thicken, narrow, and ultimately stiffen. Some may develop microscopic tears, while others might simply close off entirely. Consequently, small, isolated areas of brain tissue gradually and silently lose their vital blood supply. This process unfolds without any noticeable symptoms. There is no dramatic event, only a slow, invisible erosion of brain health. Eventually, one of two critical outcomes may occur. Either a larger brain vessel ruptures, leading to a stroke, or the progressive, cumulative damage slowly builds into a condition that bears a striking resemblance to Alzheimer's disease. This particular point is critically important, yet it remains largely unknown to the general public. Vascular dementia, which is a form of dementia specifically caused by damage to the blood vessels within the brain, is regrettably and frequently misdiagnosed as Alzheimer's, even by experienced clinicians. The telltale symptoms, memory lapses, episodes of confusion, and alterations in personality can appear virtually identical in their early stages. However, a crucial distinction exists. Unlike Alzheimer's, vascular dementia is substantially preventable. Effectively controlling your systolic blood pressure stands as one of the most powerful and accessible tools we possess to safeguard the health of your brain as you age. This is not an exaggerated claim. It is a fundamental scientific truth. Consider for a moment someone you may know who seemed to become notably forgetful in their late 60s or 70s. We often tend to accept such changes as an inevitable part of aging, while sometimes these changes genuinely are attributable to the natural aging process. There are many instances where they could have been entirely preventable. This is a difficult but important truth to acknowledge. Seriously, when your healthcare provider discusses blood pressure management after the age of 60, they are not solely focused on the health of your heart. They are also deeply concerned with preserving your cognitive sharpness, maintaining your independence, and ensuring your continued presence and engagement with the people who matter most in your life. The stakes involved in this discussion are truly that high. It's about keeping your mind fully in the room. While the brain rightly receives considerable attention when discussing the impact of high blood pressure, the issue of elevated systolic pressure does not confine its damage to just the neck up. It is a systemic, whole-body problem. The insidious damage it inflicts upon other organ systems throughout the body is equally serious and often just as silent, which renders it exceptionally dangerous. Let's begin with the heart itself. When systolic pressure is chronically elevated, your heart is forced to work substantially harder with every single beat, constantly pushing against a greater resistance, minute after minute, day after day. The heart muscle responds to this relentless overwork in the same way any muscle does. It thickens. Specifically, the left ventricle, the heart's main pumping chamber, enlarges. While this might initially sound like the heart is becoming stronger, in reality, it is becoming less efficient and less healthy. A thickened heart muscle loses its natural flexibility, compromising its ability to fill adequately with blood between beats. This pathological process can eventually lead to heart failure, a condition common in older adults, which is notoriously difficult to treat once it has become established. It is profoundly easier to prevent heart failure than to manage it once it has developed. Beyond the heart, your kidneys are also under constant assault. These vital organs meticulously filter your entire blood supply dozens of times each day, a process that relies on an intricate network of microscopic vessels. Chronic, elevated systolic pressure damages these delicate vessels over many years, leading to a gradual and often imperceptible decline in kidney function. The truly insidious nature of this damage is that you typically do not experience any noticeable symptoms until a significant portion of kidney function has already been lost. By the time routine blood tests finally flag a problem, meaningful and often irreversible damage has already occurred. This highlights the dangerous trap of silent organ damage. Furthermore, your eyes are also at risk. The retina, the light-sensitive tissue at the back of your eye, is densely lined with tiny blood vessels that are highly vulnerable to pressure-induced damage. A condition known as hypertensive retinopathy can silently degrade your vision over many years. In severe cases, this condition can even trigger sudden and permanent vision loss. The brain, heart, kidneys, and eyes. These examples vividly illustrate why chronically high systolic pressure is accurately described as a whole-body problem. This leads to a crucial question that warrants an honest self-assessment. For how long has your systolic blood pressure number consistently been above the 130 mm mark? Has it been a year, 5 years, or perhaps even a decade? The type of organ damage just described does not manifest overnight. It accumulates gradually and quietly, building up over extended periods without immediate warning signs. This prolonged, silent accumulation of damage is precisely why the most opportune time to act is right now, proactively, rather than waiting until a debilitating symptom or a medical crisis forces your hand. Now, let's discuss specific target numbers. For the majority of adults over the age of 65, current established medical guidelines recommend a goal of keeping systolic blood pressure below 130 mm. This is a significant distinction, as it is not 140 mm, but definitively 130 mm. For many years prior, healthcare providers often accepted higher blood pressure readings in older patients, operating under the prevailing assumption that some degree of elevation was simply a normal, unavoidable consequence of aging. However, a landmark clinical trial known as SPRINT fundamentally altered this perspective. The SPRINT trial meticulously followed thousands of adults over the age of 50. The findings were stark and compelling. The group of participants whose treatment regimen aimed to keep their systolic pressure consistently below 120 mm experienced dramatically lower rates of major cardiovascular events, including heart attack, stroke, and cardiovascular-related death. The trial was so unequivocally clear in its results that it was halted early. While your individual healthcare provider will tailor your specific blood pressure target based on your unique health profile, the overarching direction of the evidence is unambiguous. Achieving and maintaining a lower systolic pressure demonstrably saves lives in individuals over 60. This is the clear and consistent message derived from robust scientific evidence. Therefore, it is imperative to know where your numbers currently stand. Before delving into discussions about medication, it is essential to explore the powerful actions you can initiate this very week without the need for a prescription. These are not merely suggestions, they are tangible interventions with a measurable and significant impact on systolic blood pressure. It has been observed in clinical practice that individuals can reduce their top blood pressure number by a remarkable 15 to 20 points through dedicated lifestyle changes alone. This substantial reduction can often be the critical difference between requiring one medication to manage blood pressure and needing a combination of 2 or 3. First, sodium intake is absolutely non-negotiable after the age of 60. As we age, our kidneys become less efficient at clearing sodium from the body. Consequently, dietary salt impacts your blood pressure much more profoundly now than it did 20 years ago. The recommended target for daily sodium intake is typically between 1,500 and 2,000 milligrams. To put this into perspective, a single teaspoon of common table salt contains approximately 2,300 milligrams of sodium, exceeding the daily limit for many. It is crucial to develop the habit of reading food labels diligently, starting today. The most significant sources of hidden sodium are often not the salt shaker on your table. They are commonly found in everyday items such as bread, canned soups, deli meats, and restaurant meals. These 4 categories alone can easily push you over your daily recommended sodium limit. Second, managing your weight plays a direct and critical role. For every excess 10 pounds carried on your frame, your systolic blood pressure tends to rise by approximately 4 to 5 points. Conversely, losing those same 10 pounds can bring your systolic pressure back down by a similar margin. This isn't merely an aesthetic consideration, it's a matter of fundamental body hydraulics. Third, regular aerobic exercise is a potent intervention. Engaging in at least 30 minutes of moderate intensity activity, such as brisk walking, cycling, or swimming for 5 days a week, can gradually lower systolic pressure by 5 to 8 points over time. Consistent aerobic exercise significantly improves arterial flexibility. Remember the stiff pipe problem discussed earlier? Exercise is one of the very few interventions that genuinely slows down this arterial stiffening process day by day. By moving regularly, you are literally maintaining the elasticity of your artery walls. This is not a mere metaphor, it represents the actual cellular mechanisms working directly in your favor to preserve cardiovascular health. Fourth, effective stress management is indispensable. Chronic psychological stress triggers the sustained elevation of stress hormones like cortisol and adrenaline. Both of these hormones consistently drive systolic blood pressure upwards day in and day out. Structured relaxation techniques directly counteract these physiological responses. Practices such as meditation, deep breathing exercises, yoga, and spending regular mindful time in nature have been shown in multiple studies to reduce systolic pressure by 4 to 6 points over time. This impact is comparable to that of a low-dose blood pressure medication. Therefore, it is essential to take stress management seriously as a therapeutic intervention. Consider honestly which of these 4 areas, sodium, weight, aerobic movement, or stress management, might be your weakest point. This self-awareness will pinpoint precisely where your greatest opportunity for significant improvement currently lies. Now, it is crucial to address a pervasive cultural narrative surrounding blood pressure medication that, frankly, causes real harm and is observed constantly in clinical practice. This narrative often suggests that taking pills is a sign of personal failure, implying that if one simply tried harder, exercised more vigorously, or adhered to a stricter diet, they wouldn't need medication. This mindset frequently leads patients to resist starting medication, to quietly skip doses, or even to discontinue it entirely, because the internal narrative insists that medication signifies weakness or giving up. This harmful idea needs to be completely dismantled, as it actively prevents individuals from accessing the vital protection they genuinely require, with potentially serious consequences. Here is the fundamental physiological reality. After the age of 60, arterial stiffness represents a structural change in the body. It involves the replacement of elastic tissue with collagen at a cellular level. This is a permanent biological alteration. While lifestyle changes are incredibly powerful and can significantly slow this process and mitigate its consequences, they cannot fully reverse it. The biology of aging simply does not permit a 65-year-old artery wall to magically revert to the pliable state of a 30-year-old's. For many individuals over 60 experiencing significant systolic hypertension, lifestyle modifications alone are simply insufficient to achieve the target blood pressure. This is not a failure of willpower, it is a matter of biology. In this context, medication is not a crutch, it is a form of precision engineering. Medications such as ACE inhibitors, calcium channel blockers, and thiazide diuretics each work through different mechanisms to reduce the load on stiffened arteries. These are among the most extensively studied medications in the entire history of medicine, with well-established safety profiles. Their documented benefits in reducing the incidence of stroke, heart attack, and kidney disease have been observed and validated in millions of patients worldwide. There are many patients who walk 5 miles a day, maintain an exemplary diet, and consistently manage their stress, yet still require medication to reliably keep their systolic pressure below 130 mmHg. This is not a reflection of failure, it is an intelligent and responsible response to their individual biology. There should be absolutely no shame in working effectively with the current physiological reality of your body. Consistently taking your prescribed blood pressure medication is one of the most responsible and proactive steps you can take for your long-term cardiovascular health. Embrace this decision fully and without any guilt. If you have been resistant, have an honest and open conversation with your healthcare provider. Do not allow a misleading narrative about willpower to stand between you and the genuine protection that medication can offer. Finally, let's discuss the single most underused yet incredibly potent weapon in blood pressure management for individuals over 60. It is not a new drug, nor is it a complicated diet. It costs virtually nothing once acquired. It is your home blood pressure monitor, coupled with the simple, consistent habit of using it correctly every single day. The fundamental problem with relying solely on blood pressure readings taken in a medical office setting is a phenomenon known as white coat hypertension, which affects a surprisingly large number of patients. The mere act of being in a medical environment, the inherent anxiety, the anticipation, the unfamiliar surroundings, can cause systolic pressure to temporarily elevate in a significant portion of individuals. Some studies suggest this affects anywhere from 20% to 30% of people. Your doctor might see a reading of 144 mmHg, but when you return home, your actual pressure is consistently 128 mmHg. This presents a vastly different clinical picture. However, the reverse scenario is also true, and this particular situation is considerably more dangerous precisely because it often goes completely undetected. This is known as masked hypertension, and it is more common than many people realize. In these cases, your blood pressure might appear perfectly controlled during your office visit, leaving you feeling reassured. Yet, at home, under the actual conditions of your daily life, your systolic pressure is consistently running at 150 or 155 mmHg, and no one is aware because it is not being measured in that context. This is the perilous trap that masked hypertension sets. This is why it is consistently advised that every patient over 60 acquire a validated upper arm blood pressure monitor, specifically an upper arm cuff, not a less reliable wrist cuff. Before taking a measurement, sit quietly for 5 minutes. Then take 2 readings, separated by 1 minute, both in the morning and in the evening, ideally at roughly the same times each day. Meticulously record every single reading in a simple notebook. Bring this comprehensive log to every single medical appointment. This detailed log of home readings is often far more valuable to healthcare professionals than 100 isolated office readings. It provides a true, real-world picture of your blood pressure during your actual daily life, after your morning coffee, during a stressful afternoon, or just before bed. This rich context is invaluable for making accurate and truly informed treatment decisions, rather than decisions based on a single, potentially anxious moment in a medical examination room on a Tuesday morning. The distinction between a patient who regularly monitors their blood pressure at home and one who does not can literally be the difference between detecting a dangerous pattern early on and only discovering it after a debilitating event like a stroke has occurred. Your arteries do not take days off, and your blood pressure monitoring should not either. This habit is free, takes only 5 minutes a day, and it genuinely possesses the potential to save your life. Let's bring these crucial points together as a concise summary. We have covered a significant amount of ground today, so let's distill it into the key takeaways that are truly essential for you to remember. First, for individuals over the age of 60, your systolic blood pressure is the number that holds the most critical importance. A high top number combined with a normal bottom number is not a sign of reassurance. Rather, it serves as a clear and unambiguous warning. Second, the fundamental reason for this shift is the natural stiffening of your arteries, a biological process of aging, not simply bad luck. However, this is a biological reality to which you can actively respond, and now you understand precisely how. Third, the damage caused by uncontrolled systolic pressure is silent and accumulates insidiously over time, affecting vital organs such as your brain, heart, kidneys, and eyes. This damage can build for years before you experience any noticeable symptoms at all. This means that the optimal time to address it is now, proactively, before a symptom forces your hand into action. This message represents the core essence of this entire discussion, distilled into a single, potent understanding. Fourth, for those over 65, your target systolic blood pressure is below 130 mmHg. It is not 140 mmHg, nor is close enough sufficient. The 130 mmHg benchmark is firmly supported by robust evidence-based research and is endorsed by current clinical guidelines. Fifth, lifestyle changes are not merely supplementary, they are real, powerful medicine. Focus on reducing sodium intake, managing your weight, engaging in consistent aerobic movement, and practicing effective stress management. By stacking all four of these interventions, you can significantly move the needle on your blood pressure, often without external assistance. And if medication becomes part of your treatment plan, it is crucial to take it consistently and without any sense of shame. Taking medication is not a failure. It is an intelligent and proactive response to the realities of your own biology. Sixth, consistent home monitoring is a paramount practice. A validated upper arm cuff paired with a simple notebook provides your healthcare provider with more genuinely useful information than almost anything else you can bring to an appointment. Here is one specific, concrete action to take this week. For 7 consecutive days, check your systolic blood pressure at home twice a day, once in the morning and once in the evening. Carefully write down every single reading in a simple notebook. That is all. Just 7 days. You might be genuinely surprised by the objective data your own body reveals. Moreover, you will finally possess the precise information needed to engage in the most informed and productive conversation with your healthcare provider about your blood pressure. That 7-day log has the power to genuinely change outcomes. Remember, all the information shared today constitutes general medical information, grounded in current research and established clinical guidelines. It is not intended as personalized medical advice for your specific situation, your individual medical history, any other existing health conditions, and your current medications all play an enormously significant role in tailoring the most appropriate approach for your unique needs. Therefore, before making any alterations to your current treatment plan or your lifestyle protocol, please have a thorough and informed conversation with your own healthcare provider. They possess your complete clinical picture and are best equipped to guide your specific journey. What can be consistently emphasized is this: actively asking the right questions empowers you to take firm control of your own health. Take good care of yourself and extend that care to the people who are important in your life. You've earned it.